I am Kurt Callahan. I'm with Callahan Consulting, and I'm out of Jefferson County, out of Philadelphia, New York. We're going to be talking about COVID and workplace health and the transmission of transmittable diseases and how to avoid that, and the good value of work and health within the workplace. This is our lesson overview. I'm not going to necessarily preach the regulations. We're going to talk more of general topics and general things to do to make your workplace safe for everybody when it comes to transmittable diseases. If you're a small business especially, your workforce is specified and small. So if you lose one person, it's a huge cut. If you lose them for 24 hours, if you lose them for half a day, if you lose them for a week, we're going to talk through that. The effects of morale on your workforce is very important. The more you can keep your workforce happy to come to work, when you see people showing up to work early because they want to, not because they're told to, that's usually an indicator that you're doing things well. Efficiency and safety, we're going to talk through that. The workforce itself, we're going to talk about reputation, cost, and image, and then the compliance considerations. Okay, before we get too far into this, I understand COVID is a controversial topic. I'm going to ask you all to put aside whatever you've read on Facebook, the bathroom wall, your best friend Larry, who knows a doctor who said. We're going to talk about primarily how to keep all transmittable diseases under control in your workplace. If COVID wasn't here, we would be entering cold and flu season. And that would be the banner topic of the season. The things that we do to protect ourselves from COVID, a lot of them are the same that we're being told daily, weekly, every year, over and over again to keep ourselves healthy in the workplace. COVID has just really put it under a magnifying glass and amplified all the things we need to do. So this should be a daily culture. Everybody should be used to it. The people who don't do certain things should actually be the minority of the group where someone would say, hey, did you know that we're supposed to do this? And it promotes a cleaner, clearer workplace, and it enhances efficiency. Image. Why do people go to your business rather than somebody else down the street? Might very well be because they're more comfortable going to you, and that image could be hurt if we start talking about some of the things that happen around the workplace. Like we said, cold and flu season, other illnesses in the community. When they come about, or even when one employee comes in and a family member has been affected, it's something to consider your processes and how you've been enforcing those processes and resourcing them. And then individual illness and considerations. Nobody likes to be sick. And especially when that illness or that sickness affects the workforce or your business, it becomes a serious consideration. Spread through your force. How does it spread? Especially in a workplace, people spread it to the peers, to customers. Customers bring it in and spread it. It can be done direct means or indirect. You can get it from sneezing, handshaking, common touch areas, doorknobs, computer keyboards, telephones, or the transmission through airborne transmission. The common thought process, or the thing you hear from a small business manager owner the most is, look, I can't afford to let that guy go for today. That should also correlate the thought process. Shouldn't you be protecting what you have? If you can't afford to let that person go home, are you going to be able to afford 3 people who have to stay home because they become sick? So the thought process when someone comes in sick should be, all right, seriously, what is so important for you to be here today that you can't go home, get healthy, and keep the rest of us healthy. Transmission. They can be spread in a variety of ways. It also depends on the disease itself, on how it spreads. But again, we're trying to focus on COVID. This is also pretty much the same for flu. Breathing in airborne germs, coughs, sneezes, talking, laughing, whistling, all those things that you put out breath is putting out vapor and putting out whatever's inside your mouth and the rest of your body. Touching contaminated areas, eating contaminated food. The donuts in the break room look great. Did someone bother to close the cover after they had one? And how many other people have come through sneezing, coughing, talking, or anything else? Pathogens are also passed through feces. They can be spread to food and other objects, especially if your hands are dirty. So the washing becomes important also. Skin-to-skin contact, the handshake is something that has kind of dropped off, but is coming back, especially when we were told we can't do the handshake anymore. So keep it in mind that if you can avoid skin-to-skin contact, if you can avoid transferring from hand to hand, that becomes important. Contact with bodily fluids, saliva, urine, feces, blood, can all be passed to someone else's body. That is the vehicle for most of these, is the viruses and the diseases are transferred using the fluids in the human body. Small businesses, if you've invested into your employees, if you've had employees working for you for a while, the assumption is you want to keep them. There's nothing like a place or an employee who feels as though they have to go to work no matter what their condition is, because nobody really cares. Morale is lowered either by poor communication, poor management, a lack of growth or advancement, or not having the right tools for the job. Poor communication when it comes to sickness is for that supervisor to look at an employee and go, you don't look like you're 100% today. Would it be better to take a half day? Do you need to go see the doctor? Is there something I can do to help you? That communication becomes very important. Being able to understand, hey, this one person for one day going home to get healthy, get fluids, roll up in the blankets and watch Wheel of Fortune or whatever you do when you're sick, becomes important for maintaining that morale. So, somebody cares. Someone did me a solid. I'm going to go back to work and I'm going to give 100% type thing. Written programs. If you don't have written programs for your business, you really need to consider getting some. Like Liz was saying, that is something I can help you with. But if you don't have a written program and you let Tom go home because he's sick, but we don't let Sue go home because we need her to stay, that becomes a DOL issue. If you have a written program that says employees who are sick or exhibit symptoms of any sickness, we are going to expect to go home. We want our workplace healthy. By having that written program, everybody comes under the same policy, and there's no question marks about how come they get to go and I don't. Let the other employees know if they have to pick up extra effort, why they have to pick up the extra effort. There might still be some rolling of eyes. There might still be some, how come it's always me? But at least letting them know why you're dropping the 20 extra folders on their desk, or they have to do 3 extra oil changes today, because we're taking care of an employee who's not feeling well or who had to stay home to take care of a child who's sick, becomes important, that positive communication. And let other employees know what to expect or what to look for if they've been exposed already. So if the person came in sick, the manager was out of the office, and everybody said, yeah, they were coughing and sneezing all yesterday, come back and let the employees know, all right, well, these are the symptoms you need to look out for. If you start to feel these, please go to the doctor and get the medicine. Be cautious that you don't give out HIPAA information like well, they've been diagnosed with virus X and they had to get antibiotics. No, no, that's going too deep into it. Just let them know what to expose, what they've been exposed to, and what they should be looking for, so they can take care of themselves early. And there's one standard for everyone. Okay, there's not a standard for all the employees except for supervisors. So there's one standard for all the management, but not the workers, the hourly employees. There's one standard for everyone. That keeps everybody on the same level when it comes to how they're treated. Can you absorb absent employees' workload? Okay, and that should also be a management tool for how well you're doing cross-leveling or cross-training. If you cannot afford to lose one employee for a 12-hour, an 8-hour shift, you have identified another problem in your workplace. And that's where you've gone to a single point of failure. So if that employee gets hit by a car or a falling piano in the middle of the night, you've still lost that employee. If you're saying you can't absorb, even from a temporary condition, the workload of that employee, what you're saying is your business is in trouble. Your business is at a liability point. How will you absorb it? Who will absorb it? Can the person go home? Do they just want to go home so that they don't spread it throughout the workforce, but they can still do computer work? Is that still going to function for you? We've gotten very comfortable now with remote work and the positives and the negatives of it. Can you have a sick employee go home and still do a portion or their full shift at the computer? Can you do that? That way you eliminate the hazard, and at the same time, you're still getting the work. If not, who is going to pick up the workload for that employee? Do they know what to do? Do they have all the passwords? Do they have all the fob keys? All the stuff they need to absorb that impact? That's another thing that's going to bring out to the management, what is our cross-leveling plan? Key control is a great one. So-and-so has the key and they went home sick. Well, why did they take a work key home with them? Why don't we have a spare key in the key box at the company that we can work through this? Just another indicators for a management structure that you might want to consider. What help can you provide that person who's absorbing the workload? And then it all comes down to your cross-training plan, especially a small force. You're relying on each other, and everybody should be cross-leveling and cross-training so that either when someone's job has high density, someone can move in and help them because they understand the system, or like we're talking about, a employee either takes vacation or is sick, somebody else can do their job to the same standard, using the same systems, without that employee coming back from sickness and having a pile of stuff waiting on them, or information is lost because we didn't file it correctly type of action. Especially if your absent employee is a supervisor, it is your chance to see if their number two has been paying attention. You can consider it a mentorship and development program. If the supervisor or manager is out and the person that is their assistant or the person who cross levels with them is supposed to take over for them for that temporary position, it allows that employee, first of all, to try it out. It's very easy to sit there and be critical of your manager and your supervisor all the time until you're sitting in their shoes. And a day or two of sitting in someone's shoes is almost as beneficial as having to follow the manager or supervisor around all the time, because it forces them to live the life instead of just rolling your eyes behind their back. It is also a chance for you to find out, is this person ready for the next level? So if that number two fills in for their supervisor and does exceptionally well, is there a place where we can better use that employee? Shows good management team if there are holes within the organization. That single point of failure is crucial for so many small businesses. They rely on someone who's been doing the job for 30 years, and then suddenly that person isn't there anymore. Either they retired or, God forbid, had a medical issue. That's the wrong time to find out about it. The sickness or someone taking time off to get healthy is actually a pretty good way. 24 hours probably isn't going to kill a company. And it is your chance to realize the only person who knows how to do this and make this round to it is Larry. We need to start cross-training someone to learn from Larry just in case. Often, like I said before in the first block of this slide, the squeaky wheel, the person who sits in the break room and just nothing but talk down about the way things are done, or a supervisor, or is always in the bathroom finding that ear that's going to listen about how things would be so much better if they had their chance. Well, when they're in the seat and they have their chance, they start to realize, okay, there's a lot I don't know. So sometimes it is a way your supervisor or a peer has to stay home sick to let that squeaky wheel show either they can handle it better or they can't handle it better. That's their chance. All right, efficiency and safety. Seriously, think about it. Whether it's your common cold, the flu, or the COVID that we're currently having to deal with. You got that one employee who's sneezing, blowing their nose at least every 15 minutes, probably a lot more than that. Number one, how much work are you losing by that employee sitting at a desk, doing all those things, all of which I just mentioned are spreading something somewhere? You're probably getting 1/3 the work effort, and that's if you're lucky. Tissues, that pile of tissues or the trash overflowing with tissues becomes another issue. And then interruption of the peers by loud sneezes and other things. Not to mention the guy in the next cubicle who's trying to close the deal with an important client who is being interrupted every 10, 15 seconds by sneezing, coughing, or whatever else. Plus the customers hear that. Distraction of the peers, fear of getting sick, interruption of thought, work actions, fear of getting it. That becomes a lingering thought in the back of your employee's head of, what if I get sick? What if? So having that sick employee there isn't really helping the employee or your workforce. And then also think about the customers who interface with your people. If you're receptionist, I'm assuming that's still a politically correct term, the person who answers your phone and answers customers' questions over the phone is really sick, sneezing, coughing, has a stuffy nose, has no energy. That is what the customer's hearing on the other end of the phone. That represents your company. And if it's one of the supervisors, one of the managers talking to a major customer, really you're leaving the impression with that a customer that number one, the apathy of whoever's talking because they're sick, but also why do they have people coming to work sick? That doesn't make any sense to me. Are these people really going to focus on me and give me that type of treatment? It does ultimately help the company. It checks redundancy of employees and systems. Your documented program, when we talk about technical writing, we talk about standard operating procedures. It's a chance to look in your standard operating procedures and see if your checklists and your policies and your procedures are in place to facilitate your systems. Again, if you're relying on that one person to make it all happen and that one person isn't there, what system is in place to help somebody else try to do their job for 24, 48 hours? Enforces training programs and cross-leveling of tasks. The more you can cross-level, especially as a small workforce, and the more you can train other people to do the same jobs, becomes very important because it helps you have redundancy in your systems. But ultimately, the common complaint, the common words that you'll hear in office, or even the owner or the lead supervisor themselves is, I can't afford to take time off, or I can't afford for this employee to take time off. What that is really identifying is a single point of failure. So either, like, if it's the manager or the supervisor who uses that as a excuse, what you're saying is you haven't taken the time to mentor or develop anybody to fill in for you when it's time for you to take vacation, or when it's time for you to be sick. You're also not, if you're not doing that, you're really not allowing for that person to feel as though there's a possibility for advancement. And we talked about morale before. By teaching somebody how you do your job, by mentoring, by developing, you're giving them the opportunity to think to themselves, well, I might be able to move up if a position opens up or if things change. But if you're the only one who can do the job, you're also the only one that's going to let the company fail should something happen. Often I have seen employees hold a company hostage. What does that mean? You got that one guy who's doing your estimating and your business development. He's got his own filing system on his own external hard drive. He doesn't tell anybody how he does it, doesn't show anybody how he does it. And then you wonder why he starts coming in flip-flops and a Hawaiian shirt. Why does he start to be very rude to fellow peers or to employees? And why doesn't he listen to his management? Well, it's because, as far as he's concerned, he owns the company. You can't do without him. And they start exhibiting certain mannerisms. No one else can do this, so what are you going to do to me? Slap me on the hand? You don't like my flip-flops? Well, maybe I shouldn't come to work next week. I can say and do whatever I can, whatever I want. They can't fire me. And it leaves the company very vulnerable. Should either the employee leave without notice, should they die, or that employee suddenly finds another job that's going to pay them more, and without any notice, they just drop and go. That leaves a huge hole. And it can also create a perception of unequal treatment. And unequal treatment will get you in as much trouble especially a small business, as violating any of the rules and regulations when it comes to keeping a healthy and clean workplace. Reputation and image. Can you afford to lose a few customers? Either because of one bad moment. Think about that person who's had a cold for 2 or 3 days. Their head is throbbing. They've had no rest because they sneeze all night. What is their mannerism when they get a customer that comes in, either a frustrated customer or a customer who has a gripe or a complaint? Are they going to represent your company in a positive manner? And in most cases, the answer is going to be no. Like we already talked about, phone calls, emails, they stand on their own. If you react on the phone poorly, there's not a whole lot to take back from that, other than a manager saying, I have taken action on that employee. Typing an angry email, answering an email, or answering it with inaccurate stuff can become, emails are becoming legal documents. So if a employee is not paying attention and they say, yes, that's covered by your warranty, no matter if it's not, if it is or isn't, it is now covered by warranty. Your employee just made the company pay for that. Coughing, sneezing over the phone, that's a representation of you to customers. So you have to take that as consideration. A bad call, a complaint, rolls into worse very quickly. You already have a frustrated customer who doesn't feel as though you treated them right or gave them the right product. And if they get any indication that nobody's listening to them or nobody's paying attention to them because your employee is distracted by being sick, that call is not getting better. There is no recovering from that. That whole thing, the customer is always right, becomes even more amplified when the person they're talking to or through really doesn't seem to be giving them the time of the day. And then your reputation or image. I encourage everybody to take a walk through Indeed and read what employees say about certain companies, maybe even your peers. I've read some amazing remarks on companies, from the break room is disgusting and it should be considered a health hazard. I can't imagine why the Department of Health hasn't closed this place. That's a former employee talking about your company. Your customers have the ability to look through that. Over and over again, a lot of them will be saying, management does not care about employees here. They work us too hard. They don't let you take any sick time. They don't let you take vacation time. That again becomes a consideration for your prospective customers. So your image and your reputation become affected by how you treat your employees. Compliance, the laws, the regulations. I fully embrace New York State is difficult to keep up with. It's not always communicated correctly. It's not always positively communicated. Things will change in the middle of the night. I'm with you. Okay, you're singing the song of my people. But if you get caught, you get caught. If they have it in writing, it's in writing. Okay, the fines become a problem. Restrictions become a problem. If you can think back a year ago when they allowed restaurants and bars to open, and then almost immediately New York City was slamming doors shut, closing them because nobody followed the rules. Those are the types of things you're going to run into if you get caught, or if an employee calls the health department and complains about it. Once they've visited you once, and once they find you, you become special attention. You're the honeypot, the treasure trove. They know they got you once. What's to say they're not going to come back and get you again and get another fine and continue to show everybody they're doing their job? Okay, so once you've made the spot on the radar, there's a chance you're going to get a lot more visits. The costs, once you're caught and it's on the record, the cleanup for the costs. Now you're going to have to shut down for 48 hours, hire a professional cleaning crew to come through because you weren't following guidance about cleaning workspaces, blah, 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 blah. You had 2 employees that you forced to come into work sick. So for 48 hours, you're going to have Cervico or whoever come through and sterilize your office space and your storage space and everything. Medical costs, those become a liability because you didn't follow policy or you didn't follow procedures. Follow-on exams, time off, workman's comp, all that stuff starts to come into effect. Some of the examples I've already talked several times about employees with direct and indirect customer contact. Like Eric was saying, that also means they need to know how to interact with the customer so they don't bring in something from the customer. If they need to know that if they come up to a customer, or if a customer they go to visit them on site and their systems aren't in place and there's concern, it's okay for them to wear a mask. It's okay for them to, hey, I'm going to reschedule because something just came up, and talk to you, the supervisor. Look, everybody in that place was coughing. There were tissues piled everywhere. There's no way I'm going in there. Just as long as there's positive communication between your supervisor and the employee, that becomes important. Peers, watching what your peers do, watching what your management team does becomes the standard very quickly. If you read a policy letter, or if you walk by the employee board when an employee is reading something that's posted there, rolling your eyes and making a negative type statement, you have just undermined a system that's probably not going to help you. The system doesn't exist just because a piece of paper is stapled on your board. The system exists because everybody understands what right looks like and how we enforce that standard. Facilitation, what does that mean? Okay, well, most of this should be for the business owners who are on right now, but like both Liz and Erica have said, a documented written program. You got to have a program that you can turn to and point to. There is nothing worse or more painful than watching a business owner try to explain to an inspector what he thinks should be happening. They don't want to hear it. Don't tell me, show me. That's what they're going to say over and over again. So if it's not in writing, it does not exist, which ties straight into training. If you conduct training, if you have your employees attend training, document it. Names, dates, a backup makeup policy. That way you can show, look, I've put it in writing in my SOP. I've given them training. The one guy you caught is the one guy who keeps messing it up. So we're either going to put him on a PIP or we're going to let him find something better to do. It is very important inside your culture, top down. Managers and supervisors have to follow the procedures. There's nothing like screaming over and over again that you do not work on the assembly floor, you do not go on the assembly floor without foot protection, and then have a manager show up in dress shoes and then complain that the employees aren't doing something right. That is such a heavy thing to get past. Managers and supervisors have to do the same thing, which means if a manager or supervisor is sick, they need to go ahead and stay home. And then it's okay for someone to say, he stayed home today because he's sick and he doesn't want to spread it. That is by far a great message to send to the workforce. 30 minutes prior to any end of work. And this should be common whether you're preparing for flu season or putting your tools away, cleaning up your workstation, making sure the trash gets taken out. It is a common thing that should be an ethic in any workplace. 30 minutes prior, clean and disinfect the workstations and your area, and then make sure everything's put away where it belongs. Make sure you return things back to the common area after you've disinfected it. That should be a common process in any workplace. The products to support that stuff. Do you have enough the disinfectant wipes? Do you need to reorder? Where are we throwing this stuff? Where are we letting baskets over spill because nobody's taking out at 3/4 full? Is there an ease of access, or do you have to go to the owner's office every time you want a bottle of disinfectant wipes? It should be easy to get to. This is a training course that was put on by the NIH, the National Institute of Environmental Health Science. It is one of the courses I do have on file. Its design and target is the employees, and it goes into more depth specifically on COVID-19. So if you wanted to give a class to your employees, it is available. It is one of those things I could also give if you want me to. But if you have employees asking, there is a class available that goes into depth on what we think we know about COVID-19 and how to avoid getting sick in the workplace. Employer and worker responsibilities. Employers and workers have responsibilities under the OSHA Act. The OSHA requires that employers provide a safe and healthy workplace free of recognized hazards and follow standards. What did that just say? That just said, if you know people are coming to work sick and you're asking them to stay working sick, you are putting other employees at risk. Like we talked about the last class, does that mean your employee can file a complaint? Yes, they can. They can file it through OSHA. They can file it through DOL. They can also go through Department of Health, none of whom would you like to be in your business because of a complaint. So when it comes to having a process, a program that allows employees to know they can stay home if they're sick, you're starting to avoid those issues. There is nothing like having the government come to your small business to give you help. You don't want it unless you ask them to come voluntarily. If they're coming because of a complaint, they're already postured to find something. So it really is a good idea to enforce If you're sick, stay home. Or if I see you sick, I'm going to send you home, because you're enforcing those standards. And ultimately, you're protecting your workplace and you're protecting the collective of employees, not just one or two. Workers should participate in the development and implementation. By understanding these health policies, by understanding why, they will understand why it's okay for someone to stay home if their kid's sick, or if they're sick themselves. If they're staying home taking care of a sick kid, it's more understanding from other employees if they participate in the program and they understand what the program is and if the program actually exists. Yes, employees have a right to file a complaint with OSHA. State or local health department, the mayor, the police, it can get silly very quickly. Okay, so supporting this type of a program will save you a lot of grief. All right, COVID-19 basics. It is SARS. COVID-2 is the virus. The disease 2019 is when this particular strain came into existence. SARS is severe acute respiratory distress syndrome. It attacks your respiratory system. That's the major problem with it. Spreads very easily from person to person. That's the main concern that you'll hear all the experts talk about over and over again. Besides the fact it's really nice to have air come in and come out of your system, it spreads very rapidly, very easily. There is very little, if any, immunity in humans to the disease. Transmits person to person, mainly through coughing, sneezing, talking, breathing. All those things, you put out vapor, you put out some form of cloud. Droplet is the primary way it transmits, and that's, again, primarily from the mucous surfaces of your body, and then aerosol, suspended in the air, a good sneeze, a laugh, that type of stuff. Contact, those droplets or leftovers will be sitting on your skin, your different surfaces, your common touch areas. Touching that and then transmitting it to your mouth, your nose, your eyes, ends up helping it get into you. Other possible routes, they keep talking about fecal matter, which everybody kind of steps back and says why, but there is still a lot of no washing taking place. So a person who goes to the bathroom doesn't wash. The amount of fecal residue that's found on cell phones, keyboards, telephones, would make you fairly sick. So it is a consideration. And again, washing has a lot to do with it. Incubation period, and a lot of this is still being modified on a monthly basis. The time between exposure and the onset of symptoms, there is an incubation period. With COVID-19, the symptoms may last 2 to 14 days after exposure. The CDC indicates people are most contagious when they are most symptomatic. So the more symptomatic you are, the more contagious you are. However, when you start to exhibit symptoms especially, that's the time to isolate and to not bring it to the workplace. And as the last part says, people who have already been exposed, they may be contagious without showing symptoms. And this goes into a conversation about vaccines right now. People with vaccines can still carry. So if you've been exposed to someone who's sick, the good idea is to take some time off rather than bring it to the workplace. Common symptoms: fever, cough, shortness of breath. You can also have a sore throat, runny, stuffy nose, body aches, headache, chills, fatigue, diarrhea, nausea, loss of smell and taste. This is causing a lot of parents issues right now because it's also cold and flu season. Just about everything on that list equals cold and flu as well. A lot of parents are, kid has a runny, stuffy nose because it's cold season, but they have to go and get a negative test. Really painful for parents, but also consider it for your workplace at work. Again, does it make you more money to have someone go home, work from home, while wrapped up in blankets, drinking Theraflu or whatever makes them happy and feel better, and get them healthy rather than have them sick for an extended period? The severe symptoms, most people will get the mild symptoms and should recover, especially with the vaccine now. People will get the disease, but they actually don't have to go to the hospital. A lot like the flu shot. People will still get the flu, but it still won't impact them as much. The vaccine is not a force field. The vaccine is a tool to help you defend yourself. So will you still get sick? Sure. Will it put you in a respirator? No. So that's the important thing to keep in mind. If you get sick, though, difficulty breathing, shortness of breath, persistent pain and pressure to the chest, if you get confused, you don't have energy, bluish lips or the face, cyanosis is something that you need to look for, because what it's telling you is your system, your body, is not able to get or use the oxygen it's supposed to be getting. So it's very important that once you start having any of those bottom things happen, you need to get to a doctor, okay? Because they're going to get you checked out. They're going to get you the systems to help fix you. Don't prolong it. The people who avoid going to hospitals, a lot of them are the ones who end up on the respirators or worse. And if you have any other type of conditions, you really need to consider those as well. Person under investigation, by that you say, okay, well, this person seems to be exhibiting the symptoms, or the wife had COVID-19 2 weeks ago. We really think he needs to be put in isolation. If you have a suspect case, 14 days before the onset of symptoms, like I said, the employee will look at you and say, well, I don't feel sick. Well, you couldn't be sick for 14 days before anything shows up. And then if you get the symptoms, that's something to consider as well. Hey, go run down, get a COVID test. This is, you're covered under our medical insurance, whatever the verbiage is that you throw in with that. But at least get tested and then bring that test back so we can at least show we've done due diligence. And if you are proven sick, we're going to need you to stay home. That is to people who are trying to get by. That is one of the scary points. I can't afford to stay home because I need the money to feed my family. So make sure you explain to them some options. Can that person still do at least part of the work remotely while they get healthy or while they're under quarantine? How long does it survive? You've probably all seen the same guesses that are out there. They really don't have a solid answer. That's why it's so important to periodically clean your area, at least every day at the end of work. Make sure you clean your area down. At least that way, if something indiscriminately has gotten into your workplace, you're taking care of it. The same thing applies with your interaction with your family. Wash your hands, clean your hands when you leave work or when you get home. When we were at the height of this, as an EMT and a lot of the healthcare people, they were going into their garage, disrobing in the garage, cleaning in the work seat, washing in the work sink before they went into their family, because of the potential of a droplet or something being on their clothing, their boots, their hands, their face, their feet. All those things became a real concern to those people. Viruses may persist on surfaces for a few hours, several days. It all depends on the conditions, types of surface, how it's being transmitted. It is likely to be killed with simple disinfectant. And the link down at the bottom there are some recommended disinfectants by the EPA. That's why I keep saying, the more you disinfect and clean your area, the more you're doing the right thing. Not just for COVID, cold and flu, everything else. If you're cleaning and disinfecting, you're doing the right direction. Increased risk of severe illness. If you have heart disease, lung disease such as asthma, diabetes, suppressed immune systems, if you're overweight, all those things have to do with the efficiency of your respiratory system. If your respiratory system is already in a deficit, or if your circulatory system is already in a deficit, you have trouble circulating the needed oxygen throughout your body. So if you have any of those things, COVID-19 is a greater risk for you and for your employees. So you need to understand that. You also need to understand if they've got people with these conditions living with them, they should have the right to say to you, hey, I'm not comfortable coming in this week because, and hear them out. Don't just roll the eyes and say, oh yeah, you're just looking for time off. They could be bringing it home to, especially an elderly member of the family or an infant, and then you're in an even worse condition. So try to be receptive to these concerns. Seasonal flu versus COVID-19. COVID-19 has the potential to cause more deaths and hospitalizations. It attacks the respiratory system very aggressively. It also spreads very quickly. So when you talk about the seasonal flu, COVID-19, although most of the things we just talked about are exactly the same to avoid them for each other, that doesn't mean you get to skip your flu season, your flu shot for the year. You should go and get the flu shot. All these wipe down things, all these methods of social distancing and avoiding direct contact, all those are the same for the seasonal flu. It's just that COVID-19 is much more deadly and much more aggressive. The case rate is around 2%. The case facility rate. The one for influenza or the flu is around 0.1%. So that's one of the discriminators. The COVID-19 is much more deadly, about 20 times more deadly than the seasonal flu. 15 to 20% of individuals may suffer from severe symptoms that would require them to have medical attention. Pneumonia, shortness of breath, lower blood oxygen. That's the main concern with this, is that your body needs oxygen to perform. That's why people start getting confused. That's why certain systems like your sense of smell and other things get shut down, because your body is trying to conserve oxygen going to things that are requiring it, like your heart, your internal organs. Currently, and I'm not sure this is up to date, but they say no treatment. I think we have made some progress with some treatments that are still not maybe officiated, but we are making progress in that direction right now. And you hear a lot of discussion right now about immunity. They really haven't closed the book on how long, if you've had COVID-19, how long you're immune, if you're immune, and what is the effects of the immunity. So all those things, again, be careful what you take as a source. There's a lot of self-proclaimed experts that just showed up last night, and you got to be really careful about what you take as factual. Treatment, we do have multiple vaccines. They're talking about boosters right now. The vaccines, the Pfizer, the Moderna, and I think Johnson & Johnson are all now FDA cleared. So the fact that it's FDA cleared means it's no longer an emergency or an experimental phase. So it has been approved by the FDA. The FDA has been keeping track of what happens with the vaccines, so they have enough data to make a conclusive decision. Treatment is supportive. People who are mildly ill with COVID-19 should isolate at home during their illness if their doctor says to, okay? Doctor has to be in there somewhere. Your dog is not necessarily the best advice to take. Dogs never want us to leave our home. Make sure you talk to the doctor. Make sure they're comfortable with you self-isolating, isolating at home, following certain requirements. Potential of exposure for COVID-19 in the workplace. Does your workplace require close contact with people, whether it's customers, whether it's employees and peers, vendors? Is there a way to create a distance without hurting people's feelings? And then if you're going to hurt people's feelings, let them know what you're doing. Hey, we're doing this because our COVID numbers in the county have risen. Do specific job duties require close or repeated contact with people, especially if they have either the COVID-19 virus or a family member, or if they're coming from another area? Keep in mind, some of your vendors are coming from really high risk areas. What are your vendors doing to help reduce the spread, or are they just bringing it to our county? Keep that in mind. Is there a way for your vendor to drop the stuff outside at the loading dock, let them leave, maybe spray it down, and then position it into your storeroom? Has a community spread of the virus included cases in the workplace? We're starting to see a rise. I don't know what the expected reaction is going to be, but as we start to see a rise, what's happening within the workplace? And that's something you can reach out to your DOH folks, Department of Health, and ask questions. Hey, I'm a construction company. My guys do roofing. Have you seen a rise in cases? If so, what are some things I can use as a lesson learned? Does management foster a stay home and if sick culture? Okay, and when I say that, you can't be rolling your eyes. You can't say, yeah, you need to stay sick, but I'm not going to pay you, or something along those lines. You have to focus on, okay, well, you're going to stay sick. Are you going to sleep all day, or are you interested in doing work from the computer? Try to work with the employee and make sure that the company gets a little, the employee gets a little, but don't make them feel as though they have to work from home. If they are 100% no energy and they feel like they need to roll up into a hole and sleep for 12 hours, let them do so. And not only does management foster a clean after yourself, but are they also leading by example? Are they doing it on a daily basis? Are the products being replaced regularly? Are they looking at someone saying, I haven't seen you clean your area in 3 days. Everybody else is doing except for you. Is there a reason? That is the type of thing to foster the daily culture of cleaning up after yourself. High potentials for exposures: hospitals and medical care facilities, medical transport. The medical community, there is a more specific briefing for COVID-19 if you're interested in it. Drug treatment centers, homeless shelters, all those areas are high. Direct patient or long-term residence care, emergency medical facilities, housekeeping, meat packing. The people who clean up after us also are in high potential for exposure. So if you have a janitorial staff that comes in after hours, try to give them some love too. Make sure that they're getting masks, eye protection, gloves, maybe even have a manager visit them when they come through once in a while to let them know they're not the forgotten few, because they serve a serious service that is required for us to stay healthy. Medium protection: retail stores, public transportation, home visiting occupations, postal and warehouse workers, public services. Some of the standard medium potential for exposure: stocking shelves, checking out customers, emergency home repairs, handling mail and goods, and processing public benefits. All those things involve personal contact or contact with stuff from a person. So that's why it's medium potential. Low potential: any type of job that doesn't require contact with people known to be infected or frequent contact. Cubicles help, telephone, telemarketing, telework, being able to do Zoom work, remote work, being able to split your staff and phase them to on-site versus remote work. can really help limit the exposure. Work settings, community breakout. I know there's several areas in our local communities that are having outbreaks right now. Schools are feeling it heavy. Like I said, it's cold and flu season, so every kid that comes in with the sniffles or is blowing his nose, they're calling the parents in to have them go get a COVID test. Some of them get calls weekly. Some of them are getting calls twice a week. Sporting events, sporting and arts, social services, high density of coworkers, high contact with the general public, and examples, job activities, classroom instruction, aiding clients, serving customers. Most of us on this call probably fit that mold somewhere in there. So that brings it to a higher potential rate of exposure, which means you need to have the controls in place. Decontamination. You should have a process in place to decontaminate your workspaces as you go. If everybody comes back from a break, maybe that's a good time to redo it. There's nothing that says that it can only happen once a day. You might want to consult the health department. There are a lot of gizmos out there right now. Some of them you can make for under $20. Paint sprayers and the products that go in those paint sprayers throw a mist over a workplace. So you can spray down a workplace before you go home for the night. And after you've cleaned everything with the wipe and then you spray it down with that thing, that's about as clean as you can get. Same thing with vehicles, especially those of you who have company vehicles that are being used by multiple employees. You should have a process in place that they can decontaminate the common touch areas and the cab of the vehicle so that they aren't transferring back and forth. Use of the EPA registered disinfectant, highly recommended. Worker in building occupancy protection, knowing what percentage is supposed to be at work. Again, thinking through things that, do you really need to see everybody at work every single day? Can you rotate people through a phased plan where a percentage comes to work on one day and the other people remote in, and then they flip type thing. Clean as you go, not just for COVID and sickness, but when we talk about HAZCOM, when we talk about tripping hazards, there's no reason to not clean up as you go. Once you finish one part of the task, clean it up, put it away, then move on to the next task. The next task is not done until the cleanup has taken place and documentation has taken place. Prevention at work, wash hands. We didn't say it enough during this class. There should be no reason to not go wash your hands after removing gloves, when you're soiled, when you use the restrooms. If you've just gotten done handling products that just got dropped off by a vendor, if you've handled mail, if you've sorted mail, all those things, you should be washing your hands to make sure that you're taking the added precaution of not transferring any virus or any type of problem to your body or to somebody else's. Wear a mask. If you are in a setting where nobody is vaccinated or where there's sick people, wear a mask. Keep common surfaces such as telephone, keyboards, computer mouses, keep them clean. They should be disinfected. And if you're going to swap employees, before an employee goes on the computer, either the person using it needs to be cleaning it or the person getting on it needs to clean it. And there shouldn't be anybody getting their feelings hurt by that. Same thing for pens, pencils, staplers, paper cutters. Make sure that the products are sitting right there so when they're done, it's a reminder to wipe it down. Minimize group meetings by using phone, email. Avoid close contact when meetings aren't necessary. Avoid having meetings if it can be handled in another fashion. Over and over again, you'll hear people say, is this a meeting that could have been covered in an email? They mean it. A lot of times we have meetings for no other reason than to have a meeting. Why not see if we can handle it before we start bringing everybody into a close, congested situation? Consider telework, remote work. Limit unnecessary visitors to the workplace. As bad as it sounds, maybe now is not the right time to have family members come visit with kids to a workplace? Or if they do that, is there a separate place they can go outside to the picnic tables or whatever? But bringing them through the workplace is exposing the family, and it's exposing everybody else to what the family might bring. Maintain your physical, emotional health, rest, diet, exercise, relaxation. Keep your eyes open for symptoms. If you have symptoms, try to make sure that you stay home or get it looked at. Managers and supervisors set the tone, they set the standard. If you don't do it, your employees feel obligated to not do it as well. This is the OSHA standard that all this stuff comes under. 1910, 1200. If you sat through the first class, you know that's the general industry standard. Employers should also consider list of hazardous chemicals at workplace, labels and containers, chemical information, training, written programs, all because this feeds straight into the cleaning and disinfecting. We are going to have a separate class on HAZCOM as a general. Then we're going to talk about how to set up a HAZCOM program. But all these things should make you also think about, okay, we've got all these different disinfecting stuff. Do we have the safety data sheet? Do we have it in the book? Are we using one source, two sources, so that we make sure that we're not exposing employees to added hazards? Portable containers have to be labeled. Okay, if you're splitting things, if you get a mass thing of disinfectant, the hand sanitizer, and you're putting it into smaller bottles, that's great. Make sure the smaller bottles are labeled with what's in it correctly. Role of vaccines. The vaccine is being given credit for reducing the number of critical cases and deaths. With the uptake of the vaccine and your workplace controls, your workplace itself is probably going to be significantly reduced of hazard. Like I said before, people are vaccinated, can still be exposed, they can still carry it. It's not a force field, but it limits the impact to the person who's vaccinated. Okay, so the person might be out of work for 24 hours instead of 3 months. Continued focus on maintaining the workplace preventive processes. Continue those things. Like I said, COVID-19 gets cured tomorrow. Don't put it to bed. All these processes still work for the flu, the cold, everything else, or the next COVID that comes along.